The periodontal letter spring issue that we're sending out this time, I think is a very important one because it discusses antibiotic recommendations prior to dental treatment and after dental treatment. And this is mainly for dentists, for providers, and hygienists, and even assistants will benefit from this newsletter. So I wanted to introduce it. And basically what happened was that, if you remember, in 2007, the American Heart Association really scaled back on their recommendations for antibiotic prophylaxis for certain dental procedures and conditions. And then in May of 2021, they reviewed everything again, and they upheld their original recommendations as far as pre-existing conditions and so forth. There are some interesting additions, though, some interesting research that took place, and they did change a few things. So it's a very interesting issue. One of the things that I think is extremely interesting is how patients who report penicillin allergies, well, of those reports, only about 10% of those reports are truly accurate. And another thing that we kind of knew is clindamycin. Clindamycin, when used for dental procedures, actually shows a 4-fold increase in dental infections. So it's very interesting. So it all makes sense. The back of the newsletter has a chart that actually gives you specific recommendations for the different antibiotics. And if you don't receive the newsletter, contact us, and then we'll put you on our mailing list so that you can get these. So I hope you find it interesting and helpful. And again, really share this with your team, especially hygienists and assistants, okay? It'll really make things a lot easier for you. Take care.